Let's begin by talking about typical voice production. Voice production begins with inhalation. The diaphragm contracts and moves downwards, increasing the space in your chest cavity and filling your lungs with air. The diaphragm then relaxes for exhalation, pushing the air from the lungs up through your larynx, causing vibrations in the vocal folds. The muscles of the larynx contract to adjust the length and tension of the vocal folds. The amount of muscle contraction determines the pitch of your voice. The articulators, your tongue, palate, and lips, then move to determine the specific sound being made. The combination of all of these things is what creates your voice. What is muscle tension dysphonia? According to clinical voice pathology theory and management, muscle tension dysphonia is a speech diagnosis characterized by variable symptoms of voice disruption in the absence of laryngeal pathology caused by visible tension or stiffness of the neck, jaw, shoulders, and throat. Muscle tension dysphonia occurs when the muscles around the larynx are so tight during speaking that the voice box does not work efficiently. It is the most common voice disorder, occurs primarily between the ages of 40 and 50 years old, and is more common in women. These are the muscles of the larynx. They are called the extrinsic muscle group because they act like a slingshot and pull in different directions. This adds needed tension for speech production, but when there is too much or too little tension, this is when a voice problem occurs. With muscle tension dysphonia, the muscles are too tight because they are being pulled too much. This causes the larynx to be too tight and the voice not to work efficiently. There are two types of muscle tension dysphonia. The most common is primary muscle tension dysphonia. This occurs without an abnormality in the larynx. This type can be caused by stress, anxiety, or excessive demand placed on your voice, such as screaming, laryngitis, or loud singing. Secondary muscle tension dysphonia occurs when there is an abnormality in the voice box. Abnormalities may include a benign lesion or paresis. There are many symptoms that may occur with muscle tension dysphonia. You may experience one or many of these symptoms. Symptoms may include difficulty speaking, vocal fatigue, loss of pitch and loudness range, reduced vocal flexibility, strain, inconsistent voice, extra force needed for louder voice, neck that is sore or tender to touch, and voice that sometimes returns to normal. How to diagnose. The first step in diagnosis is a patient history discussion. During this discussion, the clinician and client will talk about the history of how the voice problem started. A speech-language pathology evaluation will also be conducted. This step may include a voice assessment done using a computerized speech lab that will allow the clinician to collect information on the patient's voice quality. Diagnosis may also include careful examination of the vocal folds using a scope. There are two types of scopes typically used. The first is the flexible laryngoscopy scope, which allows the clinician to observe the muscular patterns used during speech production. Another is stroboscopy. This scope allows the clinician to visually see and assess the vocal fold vibrations. There may also be further investigation done for other abnormalities. This may include looking for associated factors such as reflux, allergies, side effects of medication, and hormonal imbalance.
The cause of muscle tension dysphonia is unknown and usually develops suddenly without warning or explanation. However, it may be caused by irritants such as upper respiratory infection, passive smoking, acid reflux, or excessive demand placed on your voice. An example of excessive demand placed on your voice would be talking too excessively or raising your voice too loud, such as in the profession of teaching. Sometimes you may have more than one factor present when muscle tension dysphonia begins. What does muscle tension dysphonia sound like? It can be characterized by rough, hoarse, gravelly, raspy, weak, breathy, airy, whisper-like, strained, pressed, squeezed, tight, or tense voice quality. As seen below are images of normal vocal cords and inflamed vocal cords. These inflamed vocal cords could be caused by any of the characteristics described below. In order to diagnose muscle tension dysphonia, a speech-language pathologist will perform a video fluoroscopy of the vocal folds. Below is a video of a video fluoroscopy of somebody who does have muscle tension dysphonia. You can see inflammation on the vocal folds, and the voice quality can be characterized, but not limited to, breathy, airy, strained, squeezed, and tight. Voice therapy is the most common treatment for muscle tension dysphonia. Voice therapy helps improve vocal symptoms through exercises and techniques geared towards improving the way the body, muscles, and lungs work together to create voice. Voice therapy may include resonant voice techniques and massage. In addition to voice therapy, working with a counselor may be helpful for patients to reduce stress and anxiety. Botox injections are also sometimes used to help stop spasms in the voice box. Pharyngeal massage is the primary technique to reduce muscle tension. A speech-language pathologist or vocal coach can train you to do this therapy at home. How is it done? Step 1. Locate your thyroid notch, which is also known as your Adam's apple. This is the bump on your throat. Step 2. Place your index finger and thumb on both sides, slightly above your Adam's apple, in this thyroid space. Your index finger can serve as a reference point. Step 3. With slight pressure, massage the muscles on both sides in circular motion, increasing pressure as needed. Step 4. Locate your hyoid bone. This is where the back of your jaw and the neck meet. Step 5. Place your index finger and thumb on both sides just above the hyoid bone. Pinch the back of your tongue. Step 6. With slight pressure, massage the muscles on both sides. This is the suprahyoid area, and do it in a circular motion. Step 7. Locate the bottom of your jaw. Step 8. Anchor your index finger on your chin. Place your thumb under the jaw. Step 9. Massage the bottom of your tongue. This is the base of the tongue muscle, by moving your thumb in a forward and backward motion. To prevent muscle tension dysphonia, it is important to practice good vocal health. This can include, but is not limited to, drinking 8+ glasses of water a day and vocal rest. But if you see any changes in your voice, please contact a doctor. And it's also important to do some stress and anxiety relaxation exercises, such as meditation, breathing, or yoga. These are the references used to bring you this presentation today. If you have any more questions or comments, please contact Rocky Mountain University of Health Professions Center for Communication Disorders. Thank you.